Good morning, everyone.
Good morning.
Very proud to stand on the steps of the Capitol to observe the fifth anniversary of the passage of the Affordable Care Act. I'm honored to be. Hey! This morning, we'll be hearing from our distinguished whip, Mr. Hoyer, our assistant leader, Mr. Clyburn, our chair of our caucus, Javier Becerra, our special, very special guest. All of our House members welcome Jamal Lee, Dr. Renee Fox, Christine Flourier. They will explain why the Affordable Care Act is important to them. 5 years ago yesterday marks the 5th anniversary. After passage of the bill, President was on the night I was elected President of the United States. We would not have an Affordable Care Act. Thank you, President Obama. Today, in the celebration of this anniversary and to highlight our historic progress towards care, a right for every American, not a privilege for the few. We'll be brief. The facts speak for themselves, and stories from our guest. To the Affordable Care Act, it's important to note as many as Women's History Month, so I'm going to speak from the perspective of a woman. As many as 65 women with pre-existing conditions are no longer at denied coverage. No longer will being a woman be a free preventive care, including wellness visits, mammograms, cervical cancer screenings, and immunizations. In fact, overall, 76 million Americans in private plans, including 18 million children, benefited from expanded access to free preventive services with no copay under the Affordable Care Act. An additional, we're very, very happy about the policy, but more importantly, what to the people, to individuals. And we're very, very pleased at what it means to reducing health care to our budget. And on that score, I'm delighted to yield to our distinguished whip, the Democratic whip of the House, Steny Hoyer.
Thank you very much, Lee. Person in our country more responsible for the passage of the Affordable than Speaker Nancy Pelosi, and I thank her for her leadership. But for the economy, it's been budget. Sign the Affordable Care Act into law to protect patients from discrimination, make coverage more accessible, get health care costs under control. According to the CBO, the Affordable Care Act reduces the deficit by over $100 billion in the first decade of its existence, and by more than $1 trillion over the next years. That policy as well as good policy. At the same time, the law growth in health care costs, lowest rates since the 1960s. CBO reported this month that the projected deficits for 2016 to 25 will be $431 billion less than what was projected in because of Act's reforms. The Affordable Care Act is working so well deficits that the CBO keeps having to revise to their employees. Remember at the outset I said it's good for people, good for the economy, budget. Today to be joined by a business owner from my home state of Maryland who correctly predicted the positive economic law would have on small businesses. And I am now so pleased to yield to my friend, Mr. Jamal Lee from Laurel, Maryland. Jamal?
Thank you, sir. Good morning. My name is Jamal Lee. I'm the owner of Brazier Production. Yesterday marked the 5th anniversary of the passage of the Affordable Care Act and represents the beginning of access to affordable health care in America. As well as for my business owner, I can tell you health care law is the health already helping more than so many small business individuals, help them have comprehensive health care for their employees. While it may have been a difficult start for some in some places. Law is helping to lower costs, which allows small business owners like myself to spend less on insurance and more on expanding our companies and hiring new employees. When I, yeah. So when I first
What's happening?
All right. So when I first started my business, law and small business friendly provision grew by 40% last year, being concerned with outlandish costs. Owning a small business is like, it makes me happy. The constructive work that was set in motion years ago has helped many American families. It's good to know that if I get sick, the premiums won't go up. Employees won't be turned away because of pre-existing conditions. On staff that has a pre-existing condition, so we're happy about this. Pelosi and all those behind me, and of course President Obama and so many others from state to state who saw this through to ensure smaller businesses have what's necessary to succeed. I believe small businesses are the backbone of our economy, and it's important to have like-minded individuals in place to make solid for us. I'd like to turn the podium over to Assistant Democratic Leader James Clyburn. Thank you, and God bless you.
Thank you.
Thank you very much. Okay. That's what it took. Just get down to the diaphragm and they'll do it. Thank you so much. Jamal, I speak in International Healthcare Conference in 1966. Dr. Martin Luther King Jr. said, of all the forms of inequality, injustice is the most shocking and inhumane. I profound years ago, during House debate on the Affordable Care Act, I had labeled it the Civil Rights Act of the 21st century. And I am pleased and very proud that the law is living up. 129 million Americans have pre-existing conditions. 105 million Americans no longer have a time limit on their health care coverage. No longer, as the leader said, can women be penalized by insurance companies simply for being women. Thanks to the Affordable Care Act, 16 million Americans who were previously uninsured finally had the security of health insurance with kill jobs. Our economy is creating jobs at the fastest rate in the 1990s. So, as we gather here today to celebrate the 5th anniversary of the Affordable Care Act, message for our Republican. The Affordable Care Act is the law of the land. Let's work together to make it better. Floria, currently a second-year law student from Maryland. She was by her mother's plan, but she graduated in 2011. She had a pen. Fall 2014, Catherine turned 26 and brought her own insurance on the exchange. Her mom, Dr. Renee Fox, is a doctor on the board of the American Academy of Pediatrics. And I think she's here. I got the wrong color coat. You changed coat.
Federal governors. Thank you, Leader Pelosi, Representatives Hoyer, Clyburn, and Becerra, for giving me the opportunity to pick daughters. My oldest daughter, Catherine Floria, is today. As Mr. Clyburn said, Catherine graduated from college in 2011, frequent doctor's visits, and to keep her out of the emergency room and hospital. here today to tell the story of how she has benefited from the Affordable Care Act. As a pediatrician and an active member of the American Academy of Pediatrics, I've long understood the benefits of the Affordable Care Act, including one of the most popular provisions to extend parental health insurance coverage to young adults until age 26. Until it affected me personally, I did not realize what a blessing this provision would be for my family.
Forced to purchase individual coverage or go without health insurance, which have allowed. My effort. Because of the law's passage 5 years ago, I was able to remain insured on my mother's insurance plan. The first few years out of college covered by an affordable, high-quality insurance plan. I benefit from the Affordable Care Act, qualify for subsidized coverage affordable for a student. 5 years after its passage, the Affordable Care Act is still making a difference. Like my mom and the children they care for parents, and for young adults like me. I am truly grateful for all the benefits the law continues to offer, and I thank President Obama and the members of Congress here today for their efforts to.
And for seniors, that's typically meant Medicare. Because they've paid Medicare, they need that security. But sometimes seniors forget the Affordable Care Act was there to help to Medicare. Today, who are seniors know that that donut hole that required them to make payments out of pocket that could break their bank are now able to afford those prescription medications that they need. Today, we can say that over the last 5 years, seniors have saved on average $1,500 apiece over these by the Affordable Care Act. And as a proud American of Latino descent, that as well. No community who has benefited more by the Affordable Care Act than Americans of Latino descent. Over a third of Latinos in America today who were uninsured now have affordable health care insurance. That's a result of the Affordable Care Act. When you see that kind of drop in the uninsurance rate, you have to feel very proud. So, Madam Leader, leadership to my colleagues and to all our guests, we say we are very proud of the Care Act has been for all of us. Let me give you now the case of someone who can tell you personally what happens when you have a pre-existing condition. Amanda Ballou is someone who had a stroke at a very young age. She had some difficulty holding on to a job. When she finally got back to work, found that the insurance she could get from her employer was not as good as that which she had received through the Affordable Care Act. And today, she still has coverage as a result of the health marketplace and the. Let me introduce to you Amanda Jean Ballou from Minneapolis, Minnesota.
Story. Thank you, Leader Pelosi and other members of Congress for your leadership in passing insurable. I had a massive pulmonary embolism in my left lung. Part of the clot broke off and traveled to my brain, causing a stroke. At the time, I was covered by my employer insurance, but that didn't want to cover. I was no longer seen. Instead, I was in an existing condition, a drain on an insurance plan. Even though 18 months I went without health insurance, an experience that was like jumping into a shark-infested water. I quickly learned how much medication really cost and had to decide between picking up my prescriptions or paying my monthly bills. Even so, as a pulmonary embolism and stroke, there were medicines and tests that I couldn't go without in order to prevent another hospitalization. Medical bills started piling up, and before I knew it, I was 10 in debt. In the fall of 2011, I managed to get a test, just let me go. He let me go home 4 days. I went home and waited for the bills to come. I cried when I saw the total and cashed in my 401k to pay most of it. At this point, I had no choice. Employment with a collections law firm. Even knowing that that wasn't my cup of tea. Their insurance, it sure was. Unfortunately, however, in 2018, that company downsized and I lost my job and the health insurance that went with it. Fortunately, this time around, my search for individual coverage was very on me and had made a mistake. I called and spoke to a representative. I explained to her that having affordable insurance meant I could hold out for the job I wanted and not the one I had to take. but by the end of the session, she was crying too. I no longer have to worry about whether I can go get or pay for health insurance or how I'm going to pay for my medical. I no longer have to delay or skip going to the doctor. I am finally, truly putting my health first. Thank you so much for passing the healthcare law and giving me peace of mind and for letting me share my story. And now I'll turn things back over to Leader Pelosi.
They are the stories of the American people across the country. We hear this over and over again. I also, in closing, want to thank our leaders. We want to join with the Republicans in strengthening health security in our country and the economic freedom this legislation this landmark law has provided. In closing, also, I want to thank the American Heart Association, the Small Business Majority, American Academy of Pediatrics, Families USA, Moms Rising, the Young Invincibles, the National Women's Center for gathering with us today. To them and so many more organizations, thank you for making this law possible. Thank you for giving us a healthier America. Thank you, my colleagues.